You know, I've had moderate to severe asthma for as long as I can remember, starting from when I was a kid. Looking back, it almost feels like a screenplay has led me to this moment through life's ups and downs. Now I can see that this journey gave me a lung zone mindset where I'm proactively thinking about my lung health instead of just reacting to my asthma symptoms. Come on, I'll show you. Even as a kid, I knew asthma triggers for me could include pets and environmental factors like pollen and grass. I remember it was like an extreme sport, running around a lot with my friends or cousins outside, because I never knew if the neighbor's freshly mowed lawn would turn into an asthma attack moment for me. Growing up, I wasn't allowed to have sleepovers with friends. My mom was very nervous about me having an asthma attack while I was away from her. Even as I gained more independence as a teenager, she was still very protective of me. Having restrictions could feel isolating at times. No one wants to be the kid that's left out at the sleepover. But my mom was really good about making me feel normal. She never said to me, "You're sick, so you can't do these things." At the time, I just thought I had strict parents. Now that I'm all grown up, I can appreciate how hard it must have been for them. It's stressful to have a kid with a health condition like moderate to severe asthma. She was wary that an attack could happen at any time for me. She just wanted to keep me safe. Throughout my life, I struggled with asthma and was actually hospitalized countless times as a kid. I remember in the 3rd grade, I had the chicken pox, which triggered my asthma to flare up. And I ended up in the hospital with severe asthma symptoms. I know, right? Chicken pox and asthma symptoms. Yikes. My mom was huddled by my bedside with worry, and I remember being sick, but also kind of bored. Laying in bed, looking up at the hospital lights. I had been to the hospital before, and I always went home after, so it felt like a routine to me, weirdly. But looking back, I remember how worried my mom was every single time. I didn't fully realize it at the time, but I think I was fearless because I didn't know any better. These experiences made me into the strong person that I am today. If you can't tell, I have a flair for the dramatic. Maybe it's because of what I went through as a kid, but I've always been drawn to the thrill of acting on stage. I grew up singing and dancing. A classic theater kid. After high school, I started auditioning for big performances, and my teachers gave me the courage to go out and make a career out of this amazing hobby. Now I'm an actor on Broadway. Every time I would do a Broadway show, I would have inhalers hidden on the set in case I needed them during performances. The crew was amazing and helped me hide them in locations that would fit within my performance. For one show, I had a 6-minute straight dance number, and I would have to run off the stage to take my inhaler twice and then do a tumble pass back onto the stage. At times we would be doing 8 shows a week, so I was using that inhaler more often than I'd like to. When you're playing to a large audience, you want them to be able to hear you all the way in the back. Your lungs need to be able to handle it. I've struggled with breath control and lung capacity in general. I went to a vocal coach to help strengthen my vocal cords. All of this work I was putting in, all of my tips and tricks, that's when I realized this shouldn't be normal. I realized I needed to do more for my lung health. In talking to others, I realized so many of us are in the same situation, just dealing with symptoms or making accommodations. So I decided to talk to my doctor about my symptoms, and she helped me realize I can be proactive to help manage my asthma symptoms. She's actually become one of my good friends. Hey, Dr. Kaza.
Hi, Tommy. It's great to see you.
Oh my goodness, I remember the first time we met like it was yesterday. You just made me feel so comfortable, and you gave me the confidence that I could do more to manage my asthma symptoms.
I'm so glad you felt that way.
As you know, I have tried a lot of different medicines, and I figured that was just part of having moderate to severe asthma, that it was just the norm. I thought I may have to accept that this was my life until you told me about DUPIXENT.
Yes, I often recommend DUPIXENT, also known as dupilumab, for my appropriate patients who have moderate to severe asthma. It's an add-on medication that can help people 6 years and older with specific types of moderate to severe asthma to improve their lung function, to breathe better, and reduce severe asthma attacks. DUPIXENT is not used to treat sudden breathing problems.
I'm so glad that you told me about it. It's something that has worked for me. It made a difference in my life. I just feel more in control of my symptoms.
That's great, but it's good to keep in mind that in addition to potential benefits, there are potential risks to taking DUPIXENT.
Of course.
DUPIXENT can cause serious side effects, including allergic reactions that can sometimes be severe, inflammation of your blood vessels, and joint aches and pain.
Totally. It's definitely important to keep that in mind. But DUPIXENT helped me manage my moderate to severe asthma symptoms. I just feel like I can breathe better. It's so important for people to talk to their doctor about their symptoms and also their treatment options. Your doctor is the one that can help you find something that works for you and help you understand the important safety information. Dr. Kaza, what would you say to other people who feel like their moderate to severe asthma is uncontrolled?
I would say talk to your doctor. We can't help people unless they tell us about their symptoms and what they're experiencing, as well as what they hope to get out of treatment.
Yeah.
I'm so glad I was able to help you, Tommy.
And I want to help people too. I'm so passionate about airing out my experience with moderate to severe asthma because this condition is obviously so personal to me. Breathing and performing are so connected, and that's what I do for a living. This is my livelihood, my job, my career. After what I've gone through, I feel a responsibility to help others feel less alone. I've come so far. I think back to the hospital visits. I just never imagined a world where I can actually breathe and feel healthy. That became the norm for me. By sharing our experiences, we can become a support system for each other. Together, we can help find other ways to be proactive about our lung health and get into that lung zone mindset. Thank you so much, Dr. Kaza.
Here, Tommy.
Visit DUPIXENT.com to learn more.
Important safety information. Do not use if you are allergic to dupilumab or to any of the ingredients in DUPIXENT. Before using DUPIXENT, tell your healthcare provider about all your medical conditions, including if you have a parasitic Helminth infection, are scheduled to receive any vaccinations. You should not receive a live vaccine right before and during treatment with DUPIXENT. Are pregnant or plan to become pregnant. It is not known whether DUPIXENT will harm your unborn baby. A pregnancy registry for women who take DUPIXENT during pregnancy collects information about the health of you and your baby. To enroll or get more information, call 1-877-311-8972 or go to mothertobaby.org/ongoing-study/DUPIXENT. Are breastfeeding or plan to breastfeed. It is not known whether DUPIXENT passes into your breast milk. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your healthcare provider if you are taking oral, topical, or inhaled corticosteroid medicines or use an asthma medicine. Do not change or stop your corticosteroid medicine or other asthma medicine without talking to your healthcare provider. This may cause other symptoms that were controlled by the corticosteroid medicine or other asthma medicine to come back. DUPIXENT can cause serious side effects, including allergic reactions. DUPIXENT can cause allergic reactions that can sometimes be severe. Stop using DUPIXENT and tell your healthcare provider or get emergency help right away if you get any of the following signs or symptoms: breathing problems or wheezing, swelling of the face, lips, mouth, tongue, or throat, fainting, dizziness, feeling lightheaded, fast pulse, fever, hives, joint pain, general ill feeling, itching, skin rash, swollen lymph nodes, nausea or vomiting, or cramps in your stomach area. Inflammation of your blood vessels. Rarely this can happen in people with asthma who receive DUPIXENT. This may happen in people who also take a steroid medicine by mouth that is being stopped or the dose is being lowered. It is not known whether this is caused by DUPIXENT. Tell your healthcare provider right away if you have rash, chest pain, worsening shortness of breath, a feeling of pins and needles or numbness of your arms or legs, or persistent fever. Joint aches and pain. Some people who use DUPIXENT have had trouble walking or moving due to their joint symptoms, and in some cases needed to be hospitalized. Tell your healthcare provider about any new or worsening joint symptoms. Your healthcare provider may stop DUPIXENT if you develop joint symptoms. The most common side effects in patients with asthma include injection site reactions, high count of a certain white blood cell, eosinophilia, pain in the throat or a pharyngeal pain, and parasitic helminth infections. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of DUPIXENT. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Use DUPIXENT exactly as prescribed by your healthcare provider. It's an injection given under the skin, subcutaneous injection. Your healthcare provider will decide if you or your caregiver can inject DUPIXENT. Do not try to prepare and inject DUPIXENT until you or your caregiver have been trained by your healthcare provider. In children 12 years of age and older, it's recommended DUPIXENT be administered by or under supervision of an adult. In children 6 to less than 12 years of age, DUPIXENT should be given by a caregiver. Please see adjacent links for full prescribing information, including patient information.